you
meet.
have those pains without it being a heart condition?
The question is, can you have these pains without it being a heart condition? So let me not get this mixed up, okay? I'm talking about a referral pain pattern that is a heart pattern. This is a heart pattern, this is a heart pattern. This, though, pain along the medial scapular border on the back is a discogenic pain. Okay? So I'm trying to just show you the correlation of different pain patterns that are what we call referral pain patterns. Okay? People who have gallbladder pain, the gallbladder's in their right front abdomen. Okay? To mirror you, right front abdomen. That right frontal abdomen, though, also will go to the shoulder blade and up into the upper shoulder. Sometimes it will refer, though, to the opposite side into the heart and mimic heart pain or even heartburn. Okay? That's gallbladder. When we look at other, or sometimes not even any of those and go strictly to a left kidney, which mimics a left kidney stone for certain people. But again, gallbladder on the opposite side of the body, mimicking an opposite side pain, and we have to treat, again, what we find. Okay? But the body doesn't always have to follow all these exact hardwired presentations. Now, what else is interesting about a disc is when you move into different positions, those positions often will refer a sharp pain. Okay? So the quality of the pain is usually sharp when we go to the end range. Ouch, that hurts. Ouch, that hurts. Okay? And it'll be very sharp. Sometimes it will include then a radiating pain depending on the level of the disc. Okay? This will be fun for us to do just because you're such a bright group. When we look at differentiating levels of disc, let's actually talk about a couple of specific nerve levels. Okay? If you will, on your paper, trace your hand. Okay, so you've got your, actually, let me just trace my hand. So we'll just trace our hands and we'll actually review the nerves of the hand. Okay? So on my thumb side, when we look at my thumb side with my hand, the thumb side specifically has these two fingers that refer to C6 level. Okay? These we call dermatomes. C7 is the middle finger. And C8. Okay? On the inside of my arm, my elbow side, okay, so this is the back of my hand. We'll make this now my right hand. Because there's only one L and elbow, we'll use this as our T1 distribution, okay, versus the armpit where there are two L's, and we'll use those like Roman numerals where that's T2 for axilla, okay? So C6, C7, C8, T1, and T2 on this dermatomal pattern. So when you look at that, if you have pain that stings in these two fingers, okay, or if you have pain that goes into your middle finger, or even, actually technically it's half of your ring finger, okay, that's C7. Or if we come out into here in C8, then we'll look at C8 and that dermatomal pattern, okay, the levels of the disc. Now here's another interesting thing. How many of you have heard of something called carpal tunnel syndrome? Yes? Okay. So that same hand interposed, now we look at nerve levels. And nerve levels, we actually look here, median nerve and ulnar nerve. Okay? With the back of the hand, if we look at this back side, like that, that's the radial nerve. And radial nerve actually then would refer into this web space. These nerves, though, actually form beyond the neck. Okay? So we're looking at something that's beyond the disc levels. Now we're looking at radial, median, and ulnar nerves. Okay? Actually, let's see. Median, yeah, and ulnar. this is where we get our division. Median, ulnar here. So this is stays C7 in the center. Pardon me for that. There's median, there's ulnar. Okay? Median nerve then is numbness in these fingers at night. So that's carpal tunnel. Versus ulnar, these two fingers are falling asleep. Okay, but that's a peripheral neuropathy. And we'll look at that at a different time. Please?
Oh, I was just going to say, so what is that one?
Ulnar. Let me actually write them out for us, okay? U-L-N-A-R, ulnar, versus median nerve, which has to do with carpal tunnel. Carpal tunnel can also occur up in the forearm due to a teres minor attachment as well, okay? But again, these are just things that I just can't help but say. Sorry, I'm going that way. The teres minor, okay? When we look at this type of a presentation again, sharp pain is disc with the range of motion. Radiating pain into one of these dermatomes, okay? And the other thing that we often will see is weakness. So when we evaluate in our office, you'll see us quickly ascertain where the level of the disc injury is by looking at the muscle strength with the head in different positions. Okay? Can I have a volunteer? I'll actually show this one so we can show quickly how we can go through these. You want to show us?
Volunteer.
You want to volunteer, Carolyn?
How bad does it hurt? I have problems with all that.
Great. We'll just take a look. Okay? So I'll just show you how we can assess this quickly.
Okay.
Good. You can have a seat here.
Okay.
So here's a person who's already said that she has ankylosing spondylitis. With ankylosing spondylitis, the spine will actually begin to fuse. Some people will actually see that on the x-ray when we look at the entire spine as something called bamboo spine. Sometimes it's actually called railroad tracks or knife and dagger appearance to this spine. The bamboo spine is most commonly seen because the discs no longer have plasticity to them, and they actually start to lay down calcium because the disc interdigitation or the ligamentous structures are starting to deteriorate, so the body lays down calcium in an effort to try to hold that intact. Okay? The interesting thing is when we look at the different levels of the spine then, what we really want to quickly ascertain is if we can determine where that level of injury is occurring and then determine how quickly we can correct it, either by a movement that they can do, some type of an exercise for the brain, some type of an adjustment, be it with an instrument or something that they're actually doing on their own. Okay? So
Okay.
let's
Now,
just take a
I just
look.
had a shot of steroids
Uh-huh.
in that shoulder yesterday.
Oh, good. Then you'll be ready for this new movie that's coming out so you can be part of the Incredible Hulk team.
I guess so.
Okay.
But the calcium that forms then breaks off and kills you. It's like little needles, so it's horrible.
Yeah. Yeah. So let's just see what we have. Hold this arm out straight for us. Look straight ahead. Hold strong here. Don't push this downward. Good. Let's go to the opposite side. Hold this up strong. Resist. Now I'll just show you quickly how we can look at different levels of strength. C5 is in the shoulder, and it represents the deltoid muscle, middle deltoid. Hold this arm up strong. And we can see there's strength in the middle deltoid. C6 has to do with our extensor strength this way, and also partially our bicep and our upper brachium. So we can do extension of the hand, hold this back, only push it over, and she has strength there. When she curls her finger and wrist downward, so just flex it down, you can see that makes a 7. Okay? Everybody kind of see that? 7, that way? Okay, it was backwards. There you go. 7. The C7 is wrist flexion. Hold that up, down, only lift that upward. And then the curled fingers, as if you're holding onto the grips of a motorbike, both hands. 2 hands with 4 fingers each gripping onto a motorcycle tightly is C8. Okay? So close your fingers over mine. Don't let me open those. Good. So we can assess quickly those levels of discs. We have C5, C6, C7, and C8. Okay? The fascinating thing about that is if there's strength in her head in neutral, when she flexes her head or extends her head or puts her head into what we call maximum foraminal compression, we can actually assess quickly if there's an injury to the disc or a weakness then in the nerve that's firing into that muscle. Flex your chin down, so tuck your chin down. You okay there?
It hurts. But
Yes. Let's just keep it there for a moment. We'll go through these quickly. Hold this arm up strong.
Yeah. And it's usually my left arm that I can't.
Yeah, but you can see right away a significant weakness. Now this isn't a kinesiology test. All this is looking strictly at a neurologic pathway that is specific to a nerve to C5. Okay, so tuck the chin down again. So when you hold this arm up in this position again, she has a significant weakness just in that position. Hold the wrist back, keep the chin down. We'll look at C6, hold strong, don't push this fingers or wrist down. Hold the wrist down. C6 looks good, hold C7, don't pull this up. C7's weak, close your fingers over mine. And C8 has a weakness as well. So we know that she has an aberrant movement either between the joint or the disc or where this, in essence, the nerve exits. Okay? It could be caused by inflammation from ankylosing spondylitis, or it could be caused by something to do with an encroachment on the foramen or where the nerve exits, or it could be something just simply with the disc. Okay? Now, how can we determine that quickly? If it's a hard lesion like arthritis, and she puts her head into flexion, we cannot move or change that position quickly, right? It's a bony anomaly or something that's happening. If we move her head though, forward and back, so we're just going to act like a chicken neck, forward and back, out and in, that's it. Okay, that's painful for her. In, good. So we're not doing yes, no's, we're just doing out and in. Out and straight in, okay? Straight in. And the idea is to keep it horizontal as much as we can. So push your head right out, or your chin right out on my hand, and then pull it straight back in, right there. Straight out, and then tuck your chin. That's it. 2 more, and straight in. If there's aberrancy or aberrant movement in the disc, when we tuck her chin again, hold this arm up strong, don't push it downward, we see strength. So the disc between C4 and C5 is a disc problem, and we can change that strength. Flex the wrist downward, hold strong, keep the chin down, don't lift it up. Good. The problem in her neck, in her disc level between C6 and 7, C5 and 6 for this, is actually a disc problem. Close your fingers, chin down still. And also is C8, which is between C7 and T1. So we can help her. Okay? And that's what I just want to show you quickly here is there is an ability for her to change her disc presentation in her neck when we find that her neck will actually correct. Okay? And so you can fix it. We can start to change that. That's right. Okay? Now, here's